Hi, I'm Cyndi Edwards from PR Media Now. If you were predisposed to have Alzheimer's disease, would you want to know sooner than later? Well, the majority of people say, yes, please. The sooner, the better. Well, now plans are in the works to have clinics designed to do just that. Chris Moreau from Algernon Health joins us now to talk about the first of its kind NovaScan Neuroimaging clinic opening in Southeast Florida. Chris, good to see you again.
Hi, Cindy. Nice to see you too.
So, talk to me a little bit about what will be offered at this clinic.
Well, last year, Algernon Health announced that we were going into the nuclear medicine business and specifically to feature the newest technology in PET imaging scanning systems. And this device is dedicated and was developed to just scan the brain. Really, PET CT scans, they're a hybrid system in the US, are dedicated for the whole body. And predominantly, they're scanning the abdomen and the heart. They're focused primarily on cancer diagnostics and theranostics. If you need a brain scan, then you can use one of these PET CT scanners, but they're all purpose for the whole body. We're focusing just on the brain, and the benefits are twofold. One, it's a better experience for the patient because instead of lying on a very narrow table and having your head go into a large halo, people can get claustrophobic, and for some, it's a bit of a scary experience. Our scanner almost looks like a dental chair, and you're seated on an angle. A halo is lowered over your head, and the pictures are taken of your brain. The other benefit is that we are not using a CT scanner as part of our system. So each patient gets 25% less radiation when you come to our center clinic to get scanned. So this is an exciting area for us. There's a very, very significant need. While we can scan patients for beta amyloid plaques that are in the brain associated with Alzheimer's, we can also scan patients for MS, Parkinson's, brain cancer. So there are different uses that we can use our scanner for.
It sounds a lot more comfortable than a CT scan for sure. Now, how great is the need for something like this?
It's significant. There's an estimated 7 million Americans that have Alzheimer's disease in the US at different stages of the disease. And prior to about 2 years ago, there was really no need to have a confirmatory diagnosis because there were no treatments. There are now two approved antibody therapy treatments, and these treatments help to eliminate the plaques that build up, these amyloid plaques that build up in your brain. These amyloid plaques are they're a structural protein in the brain. They're normally present, but they overexpress in the Alzheimer's patient. And what happens is they begin to interfere with brain signaling and cognitive function. So the fact that you now have an option, if you have plaques and if you're diagnosed with Alzheimer's, provided that it's not too far advanced, you can take these treatments. To confirm you have these plaques, you either need a spinal tap, ouch,
Yeah.
or you can have a PET scan on a PET CT or on our system. And of course, it's painless. You are injected with a tracer about an hour before the scan takes place, and that tracer goes into the brain and it binds with the plaque. That tracer have isotopes attached, and our scanner picks up that gamma radiation. It's a very low dose, and it helps the clinician, the radiologist, determine the amount of plaque, where it's located, the density, and that's a very important part. So it's about 3 to 6 months to get in to see a neurologist in the US, and then that neurologist is going to put you through a number of steps and tests. If he or she thinks you may be suffering from Alzheimer's, they're going to do a cognitive screen. That'll be the first time you're really coming face to face with deficit, because some of us, we forget our keys, we might
Sure.
forget a name or a word. But now when you do a serious test, it's much more in your face. It's acute. So that's an important test. There's blood tests that can be done to determine if you have these plaques in your brain. And then they'll likely do an exclusionary cancer MRI, make sure you don't have a brain tumor. And part of that process is to get a PET scan to see if you have these plaques. And that would be where we would get the referral from a neurologist or a geriatrician or a psychiatrist, physicians that are managing memory loss patients, who would then send their patients to us to get a scan.
Okay, that was going to be my next question, because I was thinking everybody will just want to pay out of pocket and walk right in and say, hey, let's take a good look at my brain. But that's not the way this is going to work initially.
Yeah, I mean, there are some, a few things happened also part of in this space. So you've got two new treatments. Medicare and Medicaid removed the once per lifetime limit on brain PET scans. That was a very big thing because you could only have one. Now there is no limit. It's not really set up for as a screen. In other words, you're 30 years old, you're worried, and you want to come in and get a PET scan. We're not going to PET scan you. But if you're 50 plus, because as you age, your risk of developing Alzheimer's increases. If you have a parent that has had Alzheimer's or a not too distant relative, if you may have some cognitive dysfunction, you can actually have plaque in your brain and not have any cognitive deficit. So we would still need a referral. We will assist you to find the resources so that you can begin this journey of examination that can test and say, is a PET scan the correct next step? And, it's better to know sooner than later, because while the treatments can remove the plaque from your brain, you cannot repair your brain cells. So that cognitive function won't come back. So you've got to get plaque early. In the years ago, it was know your cholesterol. And so I think as we go forward, the phrase is going to be, you need to know if you have plaque. What's your plaque burden? It's a score. And people should know that. They want to plan their lives. They may, in fact, have disability or other insurance they can rely on. So there's lots of needs. Sorry, a long answer to your question, but
It's okay.
There's going to be a tremendous need for these brain PET scans.
And I imagine it's not cheap. So insurance, Medicare, Medicaid will help pay for these tests, correct?
If you're 65, you are covered by Medicare, Medicaid, private insurance. Some of them, different insurance programs have different deductibles. If you're not 65, say and I'm using the age 50, if you're 50 plus and you have some concerns, there is that cost may be something you have to deal with 100%, but it depends on your insurance.
Right.
It depends on not only your health insurance, but also work insurance, compensation, short-term disability. So there are a lot of different factors at play. But I think generally speaking, and you mentioned this at the outset, about 80% of Americans polled said that if they have Alzheimer's, they want to know, and so that they can plan their lives accordingly. And that might include paying for treatment out of pocket.
Yeah, of course. Now, the flagship NovaScan Neuroimaging Clinic will be in Davie, Florida. So why start there? And are there plans for expansion?
Well, we liked Florida. We haven't done this sort of independently. We brought on board when Algernon decided we wanted to go into the nuclear medicine space. We started to work with nuclear medicine experts and develop partnerships and consulting agreements with people in the know. And so when you look at the United States in terms of density of the 50 plus demographic, which is our patient population, our target, Florida has the highest density. So we really went on a search in southern Florida, sort of looked from Miami all the way to West Palm Beach. And my colleagues and I maybe looked at over 100 different locations and ended up at the HCA Florida University Medical Office space. It's a beautiful suite that we're going to step into. Just been newly built, and is the design of the suite fits our need for the clinic, the way our exam rooms and what we call our calming or an injection room layout looks like, as well as where we're going to have the scanner. And so it's really an ideal space. There's about 6.5 million people in about a 1 hour radius from our clinic. So it's about market size. That's why we decided to open there. We have plans to open up multiple clinics in every state across the U.S.
All right. Again, it is going to be called NovaScan Neuroimaging Clinic. That's what we're going to be watching for. Chris Moreau from Algernon Health, thank you very much for joining us today.
Good to see you, Cyndi. Talk soon.
Thanks so much. And we'll see you again next time. Bye bye.